I'm joined by Dr. Jo Milios. She is going to share with us her nuts to guts approach that can help with your incontinence, how to strengthen your orgasms, and also how to improve your erectile function for men who are recovering from prostate cancer treatment.
Nuts to guts is my phrase to try and encourage men to get very comfortable with our own anatomy and to use language that is a little bit more relevant to them. So we have the male scrotum with the testes, and sweeping between that is the pelvic floor in an area called the perineum at the base of the body cavity. And there's two sphincters there. There's the urine sphincter, and then there's the bowel sphincter. And what we want to do is know how to utilize those muscles for continence control and sexual function. So the easiest thing to do for guys is to just think of what it's like to be busting to do a wee or wanting to hang on because there's no toilet around. So what we do is we want to really try and just get in tune with that front urine passage. And we start that by making sure that initially we're completely relaxed in our belly and buttock muscles. So whatever position you're in right now, just let everything sort of flop. Belly flop, relax, buttock muscles. Now, if you could just think of gently squeezing the front passage as if you're stopping the flow of urine, and then just let that go. Now, the next most important part is to think of drawing the testes up or lifting the nuts to the guts and to let them drop. So there's two components, squeezing the front passage, lifting the testes or lifting the nuts to the guts, and then letting go. Almost like, as a patient said to me the other day, men bouncing their balls up and down, up and down. There's also the back passage or the external anal sphincter that will want to come in and is part of the pelvic floor. But that one tends to dominate, and most men know how to control wind, for example. But we want to make sure that we get that front passage activated because that's the weak one. That's the underutilized one, particularly men who have prostate surgery because it's the one that is removed. So to get that pelvic floor muscle function going nicely, we need to also do a combination of fast and slow twitch exercises. So the fast twitch ones are simply to squeeze and lift nuts to guts and let go 10 times rapidly. And what's really important is there's no abdominal action. We don't want to see the core being sucked in or the shoulders moving. It's very, very gentle, very specific to that area. Then we want to do some lifted holds, and it's good to start with a low number, like a 3-second hold. So we say, relax the belly and the buttocks, gently squeeze front passage, lift nuts to guts, hold, and count out loud to keep your breathing. 1, 2, 3. Then let go for 1, 2, 3. And to repeat that 10 times. And if we could do that 3 times a day, that would be fantastic. So 10 little quick ones and 10 holding ones. With the holding ones, you can gradually build up to a 10-second hold and a 10-second rest. So every set that a man should do is 10 quick ones that take about 1 second each and 10 holding ones. So that's 20 in a set. Repeating that 3 times a day is a good general maintenance. If anyone's preparing for surgery or has other problems, you might want to bump that up to 5 or 6 sets a day. And it's going to be most beneficial to do it in standing. And one take-home message is for men to simply go and stand naked in front of the mirror at home and literally just watch what happens when you try those actions to relax the belly and the buttocks, to squeeze the front passage, gently draw up the testes or nuts to guts and let it go. And then just try that little bit of a formula.
They could do it anywhere, but is standing and maybe moving around a good
Yes.
idea?
Yeah, standing's actually going to be the better one just because it takes up the load of the body. And most of the time when you're trying to train it, things like incontinence, people, women included, will only really leak when they're moving, not when they're sitting still or lying. So it's sort of more clinically applicable to train in those upright postures, which will challenge the pelvic floor. And you can even do it while you're going for a walk or doing some squats or doing some abdominal curls. You can actually integrate it with general exercise.
Clearly, training the pelvic floor is going to help with incontinence, but how does it then also help with orgasm sensitivity and also with erectile function?
When we think about the process of erectile function, that's what the endurance part of the blood flow is, the slow twitch fibers. But the fast twitch fibers are the quick muscle that happens at orgasm. So if we never actually train the quick ones, we potentially don't get the best quality orgasm. And for many years, it was unknown that these fast twitch fibers were something that we should do as part of our pelvic floor training. So if you want to improve your orgasm quality, both men and women, doing these 10 rapid contractions as quickly as you can is a really helpful training technique. For erectile function, these same muscles that I just described are all part of the opening pathways to the pelvic area, to the pelvic floor, to open and process blood flow for that penile filling for erection. So if you have a healthy pelvic floor and fast twitch fiber training, you should get improved erectile function all around.